Welcome to YourForceDate.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you, Dr. Michaels.
Nice to see you again. Thank you.
Now, our first question for you is, what are plantar warts?
Well, plantar warts are an infection of the foot or the skin by a virus. The virus usually likes small children. It can affect adults as well, but it's a virus, and it's a human papillomavirus, and this is a different type virus that does not cause cervical cancer, but it causes actually plantar warts. There's no crossover, and it causes a keratin or a callus with black dots in the middle of it to form on parts of the foot, usually on the bottom of the foot.
All right, tell us how we treat this.
Well, this plantar warts are treated various ways. There are lasers that can be used, surgery can be used, there's medications, and there's chemicals that can be used. The first line in treatment of these is to really avoid the areas where you would contract this type of virus, and that would be showers, public areas, places where you go barefoot in wet areas around other children. Now, if you could wear flip-flops or wear something to cover your feet in these areas, you'll avoid getting the warts most likely. Now, if you do get one of these, you need to seek medical attention for it because it can spread, it can stay there for up to 2 years, it can cause pain, debilitating pain, or it can just be annoying and not look very good. The ways to treat it, first we would try to put a chemical on the wart, which would cause the body to attack the wart. The chemical does really nothing if you don't have an immune system. It actually stimulates your immune system to attack the wart. And usually that works. It's simply put on with a Q-tip, it's painless, and then we put a Band-Aid on, and you have to keep the Band-Aid on and dry for 24 hours after you put it on. Now, some people have tried freezing the wart, and that doesn't work very well in the foot because the skin on the foot is so thick, the freezing doesn't get down deep enough. So the chemical actually works by tricking the body into doing what it should do. There's really no side effects with the chemical. It doesn't hurt at all to put it on. You can have some discomfort after a couple days. Now, after 1 to 3 applications of the chemical, because it doesn't always work the first time, however, it usually does, we can proceed to doing a laser removal of the wart. And we use a laser because it's less painful. That completely eliminates the area of the wart, prevents bleeding and infection, and postoperative pain. With all of these procedures, you can walk the same day, the next day. There's no period of non-weight bearing. It's a quick procedure either way that can be done in the office. It takes 2 or 3 minutes, and it's a very minor complication rate with that. So that usually takes care of it, but the mainstay for treating the warts of freezing them really doesn't work on the foot because the skin is too thick. So I think these conditions can best be treated in the office by a professional using minor surgical procedures.
All right, thanks so much. Once again, Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your questions about foot and ankle conditions only here on YourForceDate.com.